welcome back to our annual Health Week. Today we are at OMNI Orthopaedic, and we're going to talk about something that I keep saying I wish they would have had when my kids were in high school. OMNI Express Walk-in Clinic, and I have with us two guests right now. First, Dr. Daniel Charlick, who is a foot and ankle specialist here at OMNI, but also supervisor at the clinic, correct? Yes. And also we have with us Ashly Leffler, who is a physician's assistant at the Express Clinic. Good morning, guys. Welcome.
Good morning. Thank you.
Thanks for having us.
All right, so Dr. Charlick, first of all, talk to me a little bit about the Express Clinic. I mean, what was the brainchild behind all of this?
Sure. Well, you know, orthopedic care has kind of changed over time. Used to be that if you had an injury and the office wasn't open, you had to go to the emergency room or maybe an urgent care that was for general medical problems. As times have changed, things have become a little bit more streamlined for that kind of thing. As you mentioned, you know, with kids in high school sports and, you know, young kids, injuries are happening and at work all of the time, and there's really not the need to go in to be in an emergency room or an emergency walk-in clinic with all kinds of other medical issues. So one of the things that orthopedic practices have done over the years and more recently is to start to offer a walk-in clinic option, kind of an urgent care option right here in the office, which lets folks come in when they're hurt without an appointment. You know, for the typical orthopedic injuries. The things that are really severe still need to go to the emergency room. But sprains and strains and even smaller fractures, joint injuries, things like that, hand and foot injuries, mostly can be taken care of just here in the office, and you never have to go to the emergency department, which is a definite improvement, I think.
Yeah, and not only for the patient, but when you look at the emergency rooms these days and in the whole COVID situation, it's not a great situation to have to go into an emergency room.
Well, yeah, that's a good point. You know, there's no sick folks, or at least just you don't have medical problems going on, you know, here at OMNI typically. So you're not dealing with somebody who may be having an evaluation for COVID, or maybe just somebody who has the flu, or other types of diseases that might be that you could catch in the waiting room, for example. You know, it's a streamlined process because we're used to taking care of orthopedic patients here. So, you know, somebody like Ashly, one of our physician's assistants here, gets to, you know, see that person right away. They walk in, there's typically very little wait. An orthopedic provider like Ashly, we have several physician's assistants and nurse practitioners, and some of the doctors also cover the office, the clinic during the day. You see an orthopedic provider right away instead of a general provider or an emergency room doctor. So, you know, we're trained and take care of those problems every day. It cuts out usually at least one visit, which is an expensive visit to go to the urgent care or to go to the hospital. And actually, the cost of the visit here is just the same as a regular office visit,
Okay.
even if it's, you know, an emergency type of situation.
Cuts out the middleman, so to speak.
Right.
Yeah.
Mm-hmm.
So
Right.
Ashly, tell me a little bit about yourself and how you, you know, got into this.
So I'm a physician assistant. I graduated in 2017. And I initially did family medicine and decided to come over to orthopedic and explore my love for kind of the bones and musculoskeletal type of injuries. And then, so I started here in 2020, last year. So I've been here over a little bit over a year. And doing the walk-in clinic is great. We're open from 7 till 8 on Monday through Friday, and then we're also open on Saturday 8 to noon, sorry. So it allows patients to have that ability to come in when offices are typically closed, or something happens and you need to get in right away, we're there. And it really allowed us to kind of create our own practice, essentially, where we're able to give care to patients.
How do people react to it? I mean, I'm sure this, because it's a new situation, but it must be something that people like me, I would have, like I said, I would have been so happy to see something like that.
They're very grateful. I mean, patients that I saw this morning said that, oh, I have this pain and ache, but it just came on last night, so I'm going to pop in on tomorrow morning if it's still occurring, and then they get treatment right away and relief, so it's great.
Yeah.
One other thing that I wanted to mention, so the hours that Ashly just listed are for our Canton office, and here at the building on Belpar. On Munson. And we have another office that just recently started having the urgent care access as well, which is our Dover office on Oxford Street. That one has the OMNI Express going on from 8 o'clock a.m. until 4 o'clock p.m. It doesn't do the evening or Saturday at this point. It may in the future. But, that gives the option for our Dover patients or New Philly patients to come in and just walk into that Dover office anytime Monday through Friday, 8 o'clock till 4 o'clock p.m., and they can be seen immediately there. So.
That's such a great option for folks, especially in this day and age, and as you said, for somebody who doesn't really need to go to the emergency room. Well, I thank both of you for coming by and filling us in on that. Folks can go to the OMNI website and get more information about it as well.
Yeah.
Thanks for having us.
Thanks for having us.
Appreciate it. We will be back. We're going to take a break for the news here, and we will come back and talk more about sports medicine and orthopedics and occupational therapy. All of that as Health Week continues on 1480 WHBC.